2065. We'll now move to item 3, 5955.
Thank you, Mr. Chair, members of the committee. For the record, my name is Kathy Buchli, and I'm staff with the Senate Health and Long-Term Care Committee. I'll be presenting the policy aspects of this bill, and then Jenny will speak to the fiscal note. The bill before you is Senate Bill 5955, an act relating to the medical use of cannabis. As a matter of background, in the 2011 regular legislative session, the legislature passed and gross second substitute Senate Bill 5073, also relating to the medical use of cannabis. That bill permitted collective gardens to grow, whereby qualified patients and their designated providers could pool their resources and grow cannabis for their personal medical use. It also provided for arrest protection for patients who voluntarily register with a DOH, a Department of Health registry, and it provided for licensing of producers, processors, and dispensaries. The governor vetoed the sections relating to the patient registry and the licensing of producers, processors, and dispensaries. In her veto message, she stated that these sections would open public employees to federal prosecution. She further stated in her veto message that she was open to legislation to exempt qualifying patients and their designated providers from state criminal penalties when they join in nonprofit cooperative organizations. And she also stated that she's open to legislation that establishes a secure and confidential registration system to provide arrest and seizure protections to qualifying patients and those who assist them. In the bill before you, nonprofit patient cooperatives are created. If they are permitted only if local ordinances local governments adopt an ordinance permitting those cooperatives. Nonprofit patient cooperatives are nonprofit corporations that distribute cannabis for the medical use of their members who must be qualified patients or their designated providers. They may obtain cannabis from collective gardens, or they may grow up to 99 plants and keep up to 144 ounces of usable cannabis on their premises. The sections relating to collective gardens are slightly modified in the bill before you. They may only produce cannabis for their members or for nonprofit patient cooperatives. A collective garden is permitted one per property tax parcel, and contributions by members of these collective gardens may not be solely monetary. A medical cannabis registry is established in the Department of Health. The registry is to be a secure and confidential registration system for qualifying patients, designated providers, collective gardens, and nonprofit patient cooperatives. Qualifying patients and designated providers who voluntarily register are provided with arrest and prosecution protection. Collective gardens and nonprofit patient cooperatives must register their locations. Local governments may adopt zoning requirements, licensing, permitting, health and safety requirements, taxes, or other conditions upon any entity producing or processing or dispensing cannabis within their jurisdictions. They may also adopt requirements relating to nonprofit patient cooperatives if they've opted in and allowed that in their jurisdiction. These include security requirements, inspection standards, limits on the size of membership, and limits on the number of plants and amount of usable cannabis. Sales of cannabis for medical use are not subject to sales or use tax. And Jenny will speak to the fiscal note.
We've requested a fiscal note, but it is not currently available, so I'm going to speak to the portions of the fiscal note from the previous bill that seem to apply to this bill, just to give you a sense. The Department of Health estimated for rulemaking purposes that they needed $200,000 in 1113. That amount any of these amounts may go down because they constituted rulemaking for a much larger scope bill than this currently is. Additionally, the registry will cost approximately $740,000 one time and then $140,000 on an ongoing basis. And additionally, they assume about $100,000 in public disclosure costs on an ongoing basis. Additionally, we do not have information from the Department of Revenue related to the sales tax exemption. Currently, any transactions occurring with medical marijuana are subject to sales tax, according to the Department of Revenue.
Okay. Are there questions of staff? Senator Kohl-Welles.
Thank you, Mr. Chair. Kathy, some issues have come up that we've received via letter and email, so I'd like some clarification. With the authorization by the local cities and counties to be able to regulate entities, would entities include patients? Would we be changing any current law in terms of what they are able to use?
The term entity is not defined in the bill. It does say that they can regulate entities relating to the production, processing, and distribution of cannabis. Traditionally, entities refers to a business type of organization, a corporation, something like that. If you pick up a dictionary, you will see the word person, so it could be applied to a person. However, if you look at Senate Bill 5073, which was partially signed by the governor, one section of that bill specifically states that this chapter, and this bill will be entered into that chapter so that reference applies, that this chapter does not prohibit a patient from growing for his or her medical use.
Or we could amend the bill, too, to clarify.
Absolutely.
Thank you. And one part of the bill provides that qualifying patients can be members of a nonprofit patient cooperative and would have to have non-monetary participation. What could that be?
So there's basically, you have collective gardens and then you have nonprofit patient cooperatives, which are basically very large collective gardens with some different requirements for both. Collective gardens, if you are a member of a collective garden, you must contribute something other than a monetary contribution. If you want to become a member of a nonprofit patient cooperative, your contribution may be monetary.
Okay, Senator Pflug.
Thank you, Mr. Chair. One of the important parts of the previous bill, in my view, was that the physician involved had to have a real relationship with the patient. Where are we with that?
So those sections, I actually did pull in, or the bill pulls in the sections on the relation with the physician. It's in, I'm going to say section 2, but let me just pull. Yes, so it's section 2. It makes some changes to those sections, but only to remove references to licensees, which were vetoed by the governor. So as far as the relationship with the patient, the healthcare professional must complete a physical examination of the patient. They must document the medical condition. They must inform the patient of other options for treating the condition, and they must document other measures to treat that condition. And then they cannot accept money or any form of remuneration from a collective garden or a nonprofit patient cooperative. They can't offer a discount or a gift for going to a nonprofit or collective garden, and they may not examine a patient solely for the purposes, or I'm sorry, not solely, they may not examine a patient for purposes of diagnosing a terminal or debilitating medical condition. And a lot of those requirements were signed into law by the governor, so that's current law.
Senator Schessler.
Thank you, Mr. Chair. Is there anywhere in statute or AMA a list of conditions that are recommended for treatment by cannabis?
The statute provides a list of conditions, what would be considered a terminal or debilitating medical condition. This is not AMA language. This is current law in the state.
What are considered debilitating?
So those would be cancer, HIV, multiple sclerosis, conditions with intractable pain, glaucoma, Crohn's disease, hepatitis C, diseases which result in nausea, vomiting, weight loss, appetite loss, and other conditions approved by the Medical Quality Assurance Commission.
Thank you.
Senator Parlette.
Thank you. Kathy, thank you for your work on this bill. I'm interested in law enforcement. That's who contacted me from my district early on this issue, whether there was clarity on who legally could use this and who could not. Have they weighed in onto the drafting of this bill? And if so, do you know where different groups are, since we don't know that yet?
I have shared this draft with law enforcement. I hesitate to speak on their behalf. I believe there's a representative here who can.
Okay, thank you very much.
Okay, other questions? Senator Kohl-Welles.
Thank you, Mr. Chair. Kathy, with regard to the registry, there's been concern expressed about patient confidentiality and privacy. There are 14 other states and the District of Columbia that have registries.
Correct.
All of them have registries. All but one are mandatory. This provides for a voluntary one. But what do we have in the bill to safeguard patient privacy and confidentiality?
Well, access to the registry is limited to peace officers who may only access the registry if in connection with a specific legitimate criminal investigation. As far as the privacy provisions, there's a list of conditions that the Department of Health must, or a list of requirements the Department of Health must meet during the rulemaking process. They have to consult with the University of Washington Computer Science and Engineering Security and Privacy Research Lab. Personally identifiable information must be non-reversible, not susceptible to linkage by use of external data. It must allow for accuracy of the system and updating as technologies improve. And also, law enforcement the registry has to maintain a log of each verification query, so a police officer's name, agency identification number will be recorded as each inquiry is made.
Okay, so we're going to begin the public hearing part of this. We have about 20 minutes. I'm sorry, Jacinda Kastama.
Thank you, Mr. Chair. One last question I have on page 5, line 9. It says, a qualifying patient does not include a person who's actively being supervised for a criminal conviction by a corrections agency.
Part of the 20 minutes.
Do we, in fact, have that kind of restriction on any other prescribed medication?
I'll have to check with DOC to see if they have any restrictions.
Senator Kohl-Welles.
Thank you, Mr. Chair. I introduced this bill in working in a very short amount of time after we found out about the governor's veto, working with different groups. And I had been intensely disappointed by the governor's veto because 5073 had passed with bipartisan support, and I thought it was very good in terms of creating a regulated system statewide to provide for patient protections, access to legal, safe, secure, reliable source of their medicine. But we were left with a really difficult situation after the partial veto, and what we're trying to do here is to make sure that we can make the best of it. Otherwise, I'm very concerned about the weakening of patient protections, their ability to access their medicine, public safety, community safety with the proliferation of dispensaries, lack of clarity for cities and counties. And this bill before you is not perfect. It was done very quickly with stakeholder input and a lot of consideration. But we have a gray area in the law, and the law now is worse than what it started out to be. I think that we need to do something here to have clarity for cities and counties, or what we're going to end up with is lesser access for qualifying patients, less security for our neighborhoods. And I think that this bill is a good start to do that, and I welcome constructive suggestions.